Hello, everyone. My name is Matthew Webb, and I'm a student physical therapist with a CSCS and a BS in nutrition science. Today, I'm going to be taking a look at vitamin K. Phyloquinone, or K1, is from plant foods, while minoquinone, or K2, is from fermented foods, gut bacteria, organ meats, and eggs. This here is going to be the 11th in a series of educational videos intended for healthcare professionals to help us in direct access healthcare fields become more adept at identifying nutritional deficiencies so that we can get patients presenting with one of these diseases the help that they need. So, without any further ado, allow me to present to you vitamin K. Firstly, we're going to get into the very basics behind deficiency of vitamin K, then we'll break down the science behind why patients are presenting the way that they do. Then I'll give you some takeaways to help you identify this disease. When a patient has vitamin K deficiency, they can develop excessive bruising, bleeding, and decreased bone strength. And we'll go further into the science behind these presentations and the risk factors later in this presentation. But I just wanted to provide you an idea of what we're going to be getting into in this lecture right here. This is the blood clotting slide. Vitamin K is an enzymatic cofactor necessary to help the GGCX enzyme carboxylate glutamic acid. This double carboxylated compound binds well to calcium, which is necessary for the membrane binding ability seen in clotting factor proteins that allows them to bind to membranes, which of course is necessary for successful clotting. So this slide is also related to vitamin K, acting as an enzymatic cofactor for the GGCX enzyme, carboxylation of glutamic acid. However, most sources credit what this slide is talking about to vitamin K2 rather than K1. But this time, instead of that gamma carboxyl glutamic acid residue being attached to clotting factors, it attaches to matrix GLA proteins and osteocalcin. The matrix GLA proteins are accredited with making sure calcium is not deposited in blood vessels or soft tissue, while osteocalcin functions to encourage bone formation. Here's some risk factors you can look out for. Alcoholism impairs vitamin K absorption due to intestinal damage. Cystic fibrosis is another potential cause of vitamin K deficiency due to thick mucus blocking the lipases produced by the pancreas. This decreases fatty acid breakdown as well as lipid soluble vitamin absorption. Celiac disease is another risk factor because it causes intestinal damage and decreases absorption. As far as drugs go, orlistat, which is prescribed for weight loss, decreases fat absorption, which decreases lipid soluble vitamin absorption. Cholestyramine and other bile sequestrants lower cholesterol by decreasing bile reuptake in the intestines. This process decreases lipid soluble vitamins. Subjective questions to ask would be about past medical history, and you should make note of cystic fibrosis and celiac disease. Ask them what medications they're taking. Make note of orlistat and cholestyramine and other bile questions. Ask about any alcohol consumption and, of course, find out what that looks like. Diseases that individuals can be at greater risk for with vitamin K deficiency are cardiovascular disease and osteopenia or osteoporosis. As far as clinical exam goes, integumentary findings will include excessive bruising or bleeding from cuts. The main takeaway as far as the what, why, and how behind the presentation is that vitamin K deficiency can lead to excessive bruising or bleeding. This is because vitamin K is an enzymatic cofactor for the GGCX enzyme, which carboxylates glutamic acid residues and prothrombin clotting factors, allowing them to bind to calcium, which will be necessary for it to bind to membranes for clot formation. Vitamin K2 deficiency can lead to arterial calcification and decreased bone density because it acts as an enzymatic cofactor necessary to carboxylate glutamic acid residues on matrix GLA proteins and osteocalcin. Matrix GLA proteins help prevent calcium from being deposited in arteries and soft tissue, while osteocalcin supports bone formation. And here are my resources. Thanks for watching. Note that I am making these presentations during a pretty busy semester, so I'm liable to have made some mistakes. If so, let me know in the comments, and if you're correct, I'll either add it to the video description or I'll pin your comment. If you learned something from this video and you want to learn more, continue on to the calcium video, which will be the first of the electrolytes.